Hi guys, I am back with a video I've been promising you for quite some time. I have been in some other videos mentioning that I planned on making a video specifically about how to know you're choosing the right surgeon, some things that I've learned from experience, as well as my very thorough research. That's just the type of person I am, very analytical. I don't just believe what people tell me and take their word without really looking into what I'm hearing. And anytime I'm going to have any kind of medical procedure done or consider a medication, I do a lot of research. I think that when we're talking about women's health, vaginal surgery, pelvic reconstruction, there's not a whole lot of surgeries other than maybe something with your brain and your heart that I think it would be important to spend so much time looking into. So I just really can't stress the importance enough of doing your research and making sure that you are in good hands. If you come across a really great surgeon who's, renowned in your area, world renowned, whatever the case is, they're going to probably be honest with you and say that they spend much of their time in their practice fixing the mistakes of other surgeons, which that's just kind of scary, but there are a lot of surgeons out there that are not doing these types of procedures aren't doing them using the most cutting edge technology or procedures. And so we're going to talk about that a little bit, but first and foremost, I just feel it's very important to be in good hands and do your research, even if that's outside of your local area, if you don't live in an area that has somebody who's really well qualified. So I want to start out this story by telling you about how I knew I wasn't at the right place. So my gynecologist that I was seeing back then, I am now seeing a different one. To be honest, I just don't really think he had a lot of experience or knowledge with prolapses. And so when we discovered mine, he automatically suggested this woman that, he had medical connections with, who was a urologist. So she saw all types of patients, but he said, she does these sling procedures for stress incontinence, which is something you've needed done for a long time. And I really like her. She's great. Okay, fine. You're my doctor. I've trusted you to deliver my last 2 babies. So of course I'll follow your recommendation. Didn't really do a lot of research at that point. It was really after seeing her that I realized I had to look into this more. So I went to see her, and just right off the bat, the entire office atmosphere did not feel welcoming, did not feel, it just did not feel like a positive experience to me whatsoever. Strike number 1 for me, and maybe this wouldn't matter to other women, but the nurse came in, she very quickly, briefly asked me some questions. I didn't feel there was any patient care or empathy or concern in what she was saying. And then she just was like, here's a drape. You need to undress from the waist down. The doctor's going to be in to see you. And I immediately thought, okay, I'm not a very modest person, and I'm not somebody who honestly really gets worked up about gynecology appointments, but it kind of is always a tip off to me if a doctor wants to meet you for the first time when you're already half naked. I prefer a doctor that comes in, meets you, maybe hears a little bit about your story, then says, I'm going to step out, you change. But again, maybe that matters to no one else. I just feel like it goes a long way in building rapport, respect, relationships with women in a very, when you're going to examine them in a very personal area, to give them the opportunity to meet you before asking them to strip down. So that was it. But then the urologist came into the room. She was very standoffish. She just stood against her counter, and she even had her arms crossed, and she was like, so what's going on with you? So I told her, almost as if she didn't believe that I had prolapses, or what, I don't know what she was thinking, but it was just very cold and standoffish. So I told her what was going on. I kind of, started getting into the emotional weeds of I had a 3-month-old baby. This was very upsetting to me, and she was just basically like, okay, I'm going to examine you, and just kind of cut me off. So she comes over to examine me. She has me lay down on the bed, and she's kind of feeling around down there a little bit. And then the next thing I know, I feel this surprising pain down there, in my urethra. And then I hear fluid start draining, into something. And I'm like, what just happened? And she's like, I catheterized you. We need to get a clean catch of urine so we can just ensure you don't have an infection going on. So without my knowledge or my permission, she had just shoved a catheter up there and was draining my urine. And I remember just being like, whoa, I feel like, I would have given you permission to do that, but I would have liked to know that was coming. And I don't know, maybe there's some reason she does that, people freak out about it. I don't know, but it just was very off-putting to me. She does that, then she has me stand up, she does a very rough vaginal exam, and then basically she takes her gloves off and starts telling me, yep, you have prolapses. I would call them level 2 to 3 prolapses, but I think it's just your bladder. So yeah, I can fix this, no problem. I'll just put a sling in there, you know, like a mesh sling underneath your bladder. That'll hold it up, that'll help with stress incontinence, you know. 30-minute surgery, you'll be in recovery an hour, go home, back to work in 3 days. Just made it sound like it was no big deal. I do this all the time, in, out. And I just remember thinking like, okay, well, that sounds like a better fix, but I really didn't love her, but I was willing to give it a try. So she tells me I need to have a urodynamic study, which I'm thinking about making another video about because that was very scary for me. And I honestly had one bad experience with that. So I may make another video about that to alleviate some fears, but also let you know like exactly what's coming. But, so she scheduled me for 2 days later to come in for this urodynamic study. But for the next 2 days, it was very painful when I urinated. Like, I don't know if she was just really rough with the catheter insertion or what, but I was sore down there. Like, my urethra was sore. So anyway, I go in for this urodynamic study, and to be honest, it was same type of thing, like just very cold, unwelcoming. Like, it seemed like the nurse had no compassion, and it was just basically, again, like strip down, do this, do that, like very sterile. And I don't know, I just didn't feel good about it. But again, I'm gonna go through with this, I'm here for this test, whatever. So the nurse has me get up on the bed and she starts the urodynamics test, which again needs to be explained in detail to you, but she starts attempting to put this first catheter in there. I did fine just peeing in the bucket. That's the first thing they have you do. But then when she went to attempt the first catheter that had the sensor on it, they are a rather large catheter, but it was ungodly painful. And I was like, oh my gosh, stop. So she stopped, and then I told her, I was like, I've been very sore down there since the last time I was here 2 days ago, and your doctor catheterized me. So I don't know if that's what's going on. And she was like, okay, I'll try at a different angle. She goes to do it again. And at this point, I'm like, oh my gosh, this hurts so bad. I don't think I can do this. So she convinces me to attempt one more time. And that time I almost jumped off the bed, and she was like, okay, yeah, you do have some blood down there. Like when I put the catheter in, I pull it back out, there is blood on the tip of it. So I do think you have something going on, some kind of infection, or you're definitely inflamed. So at this point I'm in tears. I'm like scared of this procedure anyway. I don't like this place. This is incredibly painful. I'm not continuing with this. I am done. So, I left. I said, look, if nothing else, I have to reschedule this study. Like when I'm not sore down there, this is not working. So, I guess another tip would be, if the doctor you see catheterizes you and then wants to see you again a day or two later for the urodynamic study, I suggest waiting, like give it a week before you do that urodynamic study, because you're going to be sore anytime you've been catheterized. Or see how you feel. If you are hurting when you pee the day that you're supposed to have the urodynamic study, don't go, just reschedule, because it's going to be miserable for you. So there was that. So at that point I decided I had to look into other options. This wasn't going to work for me. I didn't feel good about this office at all. And I also knew from what I had already read that it sounded like what she wanted to do to fix my problems didn't sound thorough enough. And I also questioned whether I had more going on than just the cystocele, which is the bladder prolapse, because I was also having problems with bowel movements. So I suspected that I also had rectocele. So I decided I was going to get a second opinion, and I just basically canceled out on that office. Started doing some research, decided to go to the doctor that I had thought about going to in the first place, like because when you search in my area, vaginal surgeons, my surgeon is the one who pops up. He's the one with the best reviews. He's world renowned. People fly in from other countries. So I decided, like, why didn't I call this guy in the first place? Well, I trusted my gynecologist, but this seems like a better fit. I'm at least going to go give it a try. Got in with him pretty quickly, and it was immediately a completely different experience. You walk in the door of this place, and it's almost like, you know, I don't know, like you get an air hug. Nobody actually hugs you, but there's kind of just this feeling of like, oh, you're a woman and you have to be at the vaginal surgeon. Like, obviously this is hard. And that just felt better. This guy also is a vaginal surgeon. He is not a he is not a urologist. He's not a urogynecologist. He is a vaginal surgeon. That is what he does. Now, he has another doctor in his office that specializes in more of the urology side of things, so they kind of cooperate. But my doctor was specifically a vaginal surgeon. So I went in to see him, same type of deal. From the office people to the nurses to the surgeon, completely different. They had me stay clothed to meet him. Then he came in afterwards. We talked for quite a while in depth about what was going on with me before he went to examine me. The exam was totally different. He was gentle. It was very thorough. He did not catheterize me. He said that, you know, when I had the urodynamics study that they would get urine then, and that as long as I wasn't experiencing UTI symptoms, there was no reason to catheterize me. So after meeting with him, he basically explained to me that what the other woman was going to do to me would not have helped me, and in fact may have made my issues worse going forward. That what she was going to do was a band-aid fix that many of these urogynecologists are doing, but they don't actually fix the underlying problem, which is the tissues inside the pelvic area being the problem. Not only that, but after his exam, and then about a week later I had my urodynamics test there, it was very clear to everyone that I not only had bladder prolapse, but I had rectal prolapse, rectocele, I had uterine prolapse, enterocele, I had vaginal vault prolapse. So my vagina, again, rather than being stretched out like it should be, had just collapsed like a slinky. Stretched out slinky, collapsed slinky. Mine had completely collapsed, so that needed fixed. He also said that the tissues of my pelvic floor, the tissues of my perineum, like all of that were just incredibly weak. He could tell all of this. I was having problems emptying my bowels. I was having problems fully emptying my bladder. So there was a whole lot that needed done more than just putting a mesh sling underneath my bladder. That was not going to fix the problem. He explained that the best way to fix it would be to do a hysterectomy, because if he removed the uterus, then that's one less thing to put pressure in the future to potentially cause another prolapse. Like, basically, if I wasn't going to need it anymore because I didn't plan on having more kids, get it out of there. It wasn't doing any good. And there was some emotional component of that for me, because although I felt like I was done having kids, that was kind of a surprise. That hadn't even crossed my mind. Like, the idea of a hysterectomy was not something I had been thinking about. So that did take a little bit of an emotional toll. But ultimately, I knew that he was right, and that, you know, the best way to repair these things was to just get any organ that really could prolapse out. So that's the route I ended up going. He also explained when I met with him that many of the surgeries he does every day are him fixing mistakes made by other surgeons who do exactly what that doctor, the first one, was going to do. He's like, your body is not intended to have large portions of mesh like that. Even though the doctors now are using, you know, new mesh, not the stuff you heard about back in 2000 that was like all these lawsuits about certain kinds of pelvic mesh. It's new. It's not that stuff has been taken off the market, but it's not intended for your body to have that much mesh. So the only mesh inside me now, after what he did, is a very tiny piece like this big. I don't even know, you know, whatever, that's holding up just my urethra, instead of a sling that is several inches holding up my bladder. I just have a little piece holding up my urethra. So the less mesh, the better, at least for my research and what he was saying. And he uses cutting edge techniques. Like, he told me about several different things that were methods that he does that, you know, were the newer recommendation within the last 5 years, and that a lot of other surgeons that I had looked into weren't doing that. They were doing an old way. One great example of this is that many surgeons, when they do a hysterectomy on women, if they're leaving the ovaries, they will also leave the fallopian tubes. But according to my surgeon, and again, I fact-checked him because I just wasn't sure what I thought about this, he said you got to get the fallopian tubes out too. First of all, they serve no purpose. And he said, second, a very high percentage of ovarian cancers begin in the fallopian tubes, not in the ovaries. So he said if you get rid of the fallopian tubes, there's nowhere really for the cancer to begin, or it's much less likely to happen. So then really your only cancer risk going forward is going to be, as far as the female organs, is going to be breast cancer, because you're not going to have a cervix, you're not going to have a uterus, uterus. You're not gonna, your chances of ovarian cancer are gonna be greatly reduced by not having the fallopian tubes. So again, that's kind of a more cutting edge philosophy. Historically, the fallopian tubes have been left, and they were just only taking out what absolutely had to be taken out. But newer research is saying that really the fallopian tube should be removed also. I would also say that one thing to be looking for, again, this is just my research. I am not a doctor, but what my surgeon told me, and then in my follow-up research, he said that back in 2000, this medical equipment came out called the DaVinci robot system. And it is a robot that is frequently used in gynecological surgeries, hysterectomy, vaginal repair, whatever. And so the doctor never actually puts his hands on you. This robot, you know, the doctor guides the robot with the use of cameras and such, but my doctor said, I tried using that. He said, I tried to use it for several years and I felt like I just couldn't get the precision I wanted. I couldn't really feel the integrity of the tissues in there, and I couldn't do the repairs by hand. And I just felt like it was hindering my ability to do a good job. And he said a lot of mistakes are happening with those DaVinci robots. So he said, I do not use that. Many surgeons still do, but I do everything by hand. So again, maybe you can find a really great surgeon who uses that robot and he's wonderful at it. But what I read, if you search DaVinci robot lawsuits, DaVinci robot mistakes, anything like that, you're gonna find a lot of stories of women who've had to pursue lawsuits and things like that because this DaVinci robot was used and just messed them up, big time messed them up. So that's another suggestion that I have is, if possible, avoid the DaVinci robot. Okay, so first, just to recap, I think you need to feel very comfortable with this person. Not only are they going to be doing a very private surgery with you, but you're going to be following up with them if you're having any issues, and they need to be personable, respectful, and compassionate. Number two, you're looking for a doctor that's using cutting edge techniques and that's not just putting a band-aid on it. Okay, if they're using a bunch of mesh and they're gonna go in there and try to hold up your organs, that's not what needs to be done. My doctor went in there and hand stitched everything. Sounds crazy, but like literally hand stitched all the sides of my vagina to reinforce my vaginal walls to prevent those organs from falling through my vaginal wall again. That's what really needs done. That's what every woman needs. The reason your organs are prolapsing is that your vaginal wall is collapsing, is thin, the tissues are thin. You have to address the underlying problem. You can't just go in and hold the organs up, address the problem. I had a variety of other things though. He also had to fix the vagina. He did the repairs on all of the different prolapses. He put in the sling all at the same time. And again, I have a very, very tiny piece of mesh and that is it. So I would suggest that also. Do your own research, but I suggest if you're having a hysterectomy and they're leaving the ovaries, have them take your fallopian tubes to help prevent cancer. That's huge, I think. And then again, I would suggest avoiding a surgeon that uses the DaVinci robot system, the assisted robot for these type of surgeries. I just think you have to feel really good about it. Look for a vaginal surgeon, not just a gynecologist, maybe not even a urogynecologist, vaginal surgeon. That's what you need to be looking for, with great reviews, historically great reviews, not just recent, not just old good reviews, new reviews that are good, old reviews that are good. And do your own research. Know exactly what they're going to do for you. You're not going to want to watch those videos. You're not going to want to know exactly what they do, but I've linked some of them in my channel. I suggest you reading up on the procedures that you're going to have done so you know exactly what to expect. And if you get any type of bad feeling other than you're worried about the surgery because it's scary, go somewhere else. Get a second opinion, maybe get a third opinion. Okay, that's all I've got about this. I think I'm going to make a video about a urodynamics study so that you know what to expect with that. And it's not really as scary as it sounds, as long as you have the right nurse doing it. And they're gentle, again. All right, so I am not making any money off this channel. That's not why I'm asking you to subscribe or like it or whatever. But I have found in my experience with YouTube analytics that the more people who like this, the more frequently my videos are going to pop up in searches. So to help other women find this content, please subscribe. Thank you.